white coat hypertension, meaning their blood pressure is normal when they are at home or at work within the normal range, and only when they come to the office or clinic and have their blood pressure measured there, it is high. Well, the next topic is ambulatory BP or blood pressure. This ambulatory BP in clinics and health centers, we refer to it as ambulatory blood pressure monitoring, or Holter. What does ambulatory mean? Sometimes patients who visit us, we might take their blood pressure the first time and see that it's high. We mentioned that usually in such cases, we repeat the measurement after 1 minute or more. And we said that the patient should have their blood pressure measured at least twice. We should take it from them and even more, so that we reach this effect and define that the patient is convinced about their blood pressure. Or so that we reach this conclusion and confirm whether the patient is suffering from high blood pressure or not. But still, despite the work we do, some patients might experience stress and anxiety due to the environment, the treatment space, where the doctors present there, which could cause their blood pressure to appear higher than it actually is. We call this white coat hypertension, meaning the white coat blood pressure. This is because the medical staff who usually take blood pressure wear white coats, and when the patient sees this white coat, they experience anxiety and stress, which leads to an increase in their blood pressure. We see this very frequently, meaning there are individuals who say that when they measure their blood pressure at home, it is completely normal. But in the clinic or doctor's office, their blood pressure is high. It might even be up to 30 millimeters of mercury higher than the actual level, and this can lead us to mistakenly label the patient as hypertensive and prescribe medication. To prevent this, we perform ambulatory blood pressure monitoring for the patient. Or in other words, use a portable ambulatory blood pressure device. In this way, we attach devices to the patient's chest that have a cuff, and we monitor the patient for 24 hours. This means we send the patient home, and the device automatically measures the blood pressure every hour. Meanwhile, the patient continues with their daily activities without any restrictions. Whether they are walking, sleeping, or working, the device records the blood pressure. In some individuals, after 48 hours, you can remove it, and we monitor the patient's blood pressure. And the blood pressure curve is crucial for us to determine whether the patient has hypertension or not. We usually look at the average blood pressure, the blood pressure during the day, and the blood pressure at night, and typically the patient's blood pressure shows us whether the patient needs to be prescribed antihypertensive medication or not. Usually these individuals are those with white coat hypertension, meaning their blood pressure is normal when they are at home or at work within the normal range, and only when they come to the office or clinic and have their blood pressure measured there, it is high. Such individuals do not need to be prescribed blood pressure medication. The second help that ambulatory BP provides us is regarding individuals who have masked hypertension, meaning hidden or masked hypertension. These are the opposite of the second group. These are individuals who, in their normal state, have sympathetic activity, meaning their sympathetic system is active throughout the night and during the day, and during their daily activities, and during their usual activities, they have high blood pressure. Their blood pressure is at a level that requires medication, but when they come to the office and clinic, and there they find an opportunity. They find a situation where they can rest, and their relaxation during that short period they are in the clinic causes the blood pressure we measure to be detected as lower. Meaning if the patient's actual blood pressure is, for example, 160 milliliter during the day, in the clinic it shows as 120 milliliter. And we mistakenly think the patient does not have hypertension. This leads us to stop their medication or not prescribe them any. Therefore, we must also pay attention to this point and ensure that we can manage embolism for such individuals. We perform BP measurement there, so we measure blood pressure in an ambulatory manner. Therefore, ambulatory BP measurement is used for two groups. One is white coat hypertension, and the second is for patients with masked hypertension. In these two groups, it helps us determine the next treatment plan. Now, which of these is worse? The second group, because the second group, which has masked hypertension, actually has high blood pressure throughout the day. They definitely need medication. And if we mistakenly do not diagnose it, we won't prescribe medication, and the long-term effects of high blood pressure will appear on the body's organs.